Prediabetes is a condition in which your blood sugars are higher than normal, not quite to the level of full-on diabetes, but higher than a normal person's blood sugars. The reason it's important, if it's left unaddressed, it can progress to full-on diabetes and is likely to.
Type 1 diabetes, generally we see this develop in adolescence or a younger person. In type 1 diabetes, the pancreas produces very little to no insulin, so these patients do require insulin therapy. Type 2 diabetes is a condition where either the pancreas produces a little less insulin or the body becomes resistant to insulin, and we see higher blood sugars. Generally, type 2 diabetes does develop later in life, like in adulthood. We sometimes see it in younger individuals, but generally is farther down the road. Symptoms that might lead you to wanting to get that screening done would be increased thirst and urination, any visual changes, blurred vision, and sometimes low energy can be a sign as well.
Individuals that are most at risk for type 2 diabetes would be individuals that are either overweight, over 45 years of age, have a family history with a first-degree relative, parent or sibling with diabetes, those that are not physically active, generally being active less than 3 times a week, individuals with a history of gestational diabetes or giving birth to a baby that is larger than 9 pounds, certain ethnicities, including American Indians and Alaskan Natives, or individuals with PCOS.
So if you do have risk factors for developing type 2 diabetes, we recommend that you get a hemoglobin A1C finger test. It's a really simple lab test that we do here at Yellowhawk. It's important to do this screening because if we catch it early enough, we can implement lifestyle changes and sometimes medications, and we can prevent you from developing type 2 diabetes.
Once you receive this diagnosis, you would meet with your doctor and come up with a care plan, recommend maybe lifestyle changes, diet changes, and possible medications to treat the condition.
Some self-management tips for a person with type 2 diabetes include staying active, having a healthy diet, working closely with your primary care team, making sure that you're getting those annual screenings and exams, such as eye exam, foot exam, and it's also very important to take your medications as prescribed. So if a patient is interested in screening for type 2 diabetes or lifestyle changes, we recommend that they reach out to their primary care team at Yellowhawk.
Gestational diabetes is developing high blood sugars during pregnancy in a person who does not already have diabetes. Those who have gestational diabetes do tend to have a higher risk of later on in life developing type 2 diabetes.